Okay, it is 2 minutes after, and I'm respectful of people's time, so let's get started. Hi, Hilda again, People Bright Consulting, and welcome to our series on COVID-19 Tough Decisions for Business Owners. Today is episode 21, and it is about how to maintain mental health while working from home. I'm pleased to have East Gwillimbury as one of our partners and sharing in our presentations. We started COVID-19 Tough Decisions for Business Owners, or TDBO, as I like to call it for short, March 23rd. It was in response to the changes that happened in Canada where emergency measures were happening and legislation was supporting workers, businesses, and families and individuals. So we thought we would start this webinar series to help managers, business owners, and HR professionals figure out some of the tough decisions they were making and give tips and strategies on what to do. If you like us, tag us at PeopleBright and at hashtag COVID-19 TDBO on the various social medias. Again, special acknowledgement to the East Gwillimbury Chamber of Commerce for helping us with our presentations, get it out there so others can learn. The next slide, Jenny. So a little bit about myself. I am the founder and president of People Bright Consulting. We are a full service HR consulting firm, and I'm the proud creator of a concept called Connect with Rev Up. I do manager and team training to really help businesses with their communication skills and creating a healthy workplace. Prior to People Bright Consulting, my husband and I actually had an engineering company, and we grew that company from 2 people to 125 people in 7 offices across Canada. We were very proud of the company we created. We wanted it to be special, where people felt challenged in the work that they did, and they really enjoyed being there, i.e. positive work culture. We were recognized by Best Workplaces in Canada as one of the top 10 twice. And from that experience of building a company, of scaling it successfully and selling it, I decided that people is my passion. And I created the People Bright and the Rev Up concept from the experiences that we had. I work in healthcare, engineering, professional services, IT, and not-for-profits. The next slide. I would love to introduce you now to Kim Dechaine. She is the founder of Inner Powered Leaders, and she offers programs on mindfulness, self-leadership, and productivity, building happier, healthier, and wealthier organizations, lives, and community. That is her passion. She's an expert on burnout and mindfulness at work, and I couldn't think of a better person to come and join me today to help really talk about some of the challenges that we are facing in this very, very COVID stressful time. She's a sought-after speaker and a workshop facilitator and a leadership coach, and she is focused on helping increase that bottom line and ending burnout. Without further delay, I am going to share with you Kim. Please focus on listening to her and what she wishes to share. The next slide, Jenny, and then we'll stop sharing and let Kim take over. So our focus is really helping promoting mental health. I do encourage you to put in the chat box comments that resonate with you when you hear what Kim is going to share. She has some polls that she wants to also do. So we are expecting it to be interactive, and the more you share, you'll give tips to other people. So let's stop share and let's Kim take over from us.
Excellent, thank you. So I'm just gonna share my screen. All right, excellent. Well, thank you so much, Hilda, and it's such a pleasure to be here with all of you today. So just a little bit more about me, so you get to know me a little bit. I am a wife and a mother of 2 daughters who are 12 and 14. I grew up on a ranch and a farm in southern Alberta, riding horses and rodeoing. I was a classroom teacher for 13 years. I was a foster parent for 2 years when we took in 2 of my cousin's children. I am a survivor of mental illness and burnout, and this is why it is such a passion for me. I am a certified integrative mental health coach. I am a wellness, leadership, and mindfulness expert, and I am on a mission to prevent and end overwhelm and burnout, and it actually is possible. So the overwhelm right now is real, right? We have had kids at home, we have had working from home, we've had the fear of the virus, and now we're kind of starting to open up, and we're just uncertain of what is going to happen next. And the longer that we stay immersed in this overwhelm of all of these different emotions, the harder it's going to be for us to come out of this mentally strong. So burnout, overwhelm is at an all-time high. So I would like to start with just a poll right now to see how you have been feeling over the last 3 months. So Jenny's going to get that up. So what emotions have you felt? And so you can pick as many as you can, I think. Is that correct, Hilda? I think you can.
Yes,
yeah.
Multiple choice.
Yeah, so go ahead. What emotions have you felt over the past 3 months? And then you can hit submit. And Jenny, when that's ready, if you can just give me a little, you can just say, Kim, I'll stop. We'll continue on then.
Yeah, continue on, and then Jenny will tell you when it.
Perfect. So right now, what we're finding is that we are having a mixture of a ton of different emotions in a very short amount of time, which we're not used to. And everyone in the world is feeling these different mixtures of emotions. And so our support systems have even changed because everyone is feeling this way. So I'm just switching here. So the number of Canadians reporting high levels of anxiety quadrupled in the first month of the pandemic. So I think that just really opens up our eyes as to where mental health is. And you know, the year that it predicted that depression would become the second leading cause of disability in the world is this year, and it's going to become that. And so it's not just a crisis for our health and our happiness, but it is a crisis for our economy. It's costing us $50 billion a year in Canada in lost productivity. And 500,000 workers a week are off work due to stress leave in Canada. And 40% of professionals say that they are on the brink of burnout and that the contributor is stress from work.
So this is a good time to share the results of that poll. A total of 10 people shared. And
right.
Do you guys see those results now?
So 100% of those 10 people have felt anxiety, right? So we have anger, fear, overwhelm, loneliness. And so we can see pretty much that peace, contentment isn't, it's, you know, kind of in the middle. Joy, those more positive ones are lower. So this really just shows, even within us who's here today, how this is impacting us. So we can't control the circumstances surrounding the overwhelm right now, but we can control how we react and how we deal with it. So my belief on mental health and mental strength is that we need to be proactive and we need to be training our mind consistently. And if we do this before we start struggling and before we get overwhelmed, we can prevent it from happening. So to be mentally strong, this is my process of what I like to focus on. First, we focus on our head, our heart, and then our hands. And our head is our mind, and it is looking at awareness and focus. Once we have that, then we can focus on our heart and choose compassion and kindness for ourselves and others. And then we take action. And if we have trouble taking action, we go back then and we become mindful, we become aware of our thoughts so that we can continue with that process. So if we want organizations to have strong, mentally healthy people, the first thing we have to focus on is self-leadership. And that is the ability to manage your thoughts, your feelings, and your actions. So self-leadership starts in the mind, right? If we cannot lead or control our mind, then to a large degree, we are unable to lead our lives, let alone lead other people. And when we truly lead ourselves, it manifests itself as strength, determination, control, and balance. And, it's about managing ourselves so that we can lead our people, creating more meaning, connectedness, and more people-centered cultures. So how do we start self-leadership? Well, we begin with self-awareness. And this is the ability to monitor the mind so that we can lead it better. It's a skill of being aware of our thoughts, our emotions, our values, moment to moment. So leaders help others regulate their emotions, but first we have to be able to regulate our own emotions. So awareness is like the sun. Awareness is like the sun. When it shines on things, they are transformed. And so self-awareness helps us to transform ourselves so that we can lead others forward positively and consciously. So to have self-awareness, we need to practice just being aware. It's the ability to notice what is happening around you and inside of you. Awareness allows us to notice when our focus goes astray and helps us to redirect it back on track. And the more you have a personal practice, the more it will come out in your team and all of your relationships. So practicing awareness can be hard because our mind is so overwhelmed, right? We are so full. So we need to learn how to slow down our mind, not how to completely clear it, because that is actually impossible to completely clear our mind. So we just need to we needed to do this before COVID, and now we need it more than ever. And the way we start training our brain to slow down is focusing on the present moment. And the big word for this is mindfulness. Okay? So mindfulness helps me to gain clarity and reshape myself to become a better version of me. And I feel like people don't realize how many people use mindfulness to succeed, right? Majority of pro athletes, teams, coaches, actors and actresses, artists, and chess players use mindfulness to help them succeed. The British Parliament actually teaches mindfulness to their politicians to help make better decisions. So why wouldn't we use it in the business world to increase our well-being and our productivity? So I feel it's really important for executives and employees to understand that they are operating at their own professional and elite level. There is a need to bring the same focus and clarity to their work as it would be a quarterback or a professional basketball player. So I want to just quickly put it into perspective for you in the business world. So my friend Todd Herman is a global leader in peak performance and lives in New York City. He recently spoke to 29 top CEOs of companies making $200 to $500 million a year to unpack their psychology, plans, and their current experiences in this crisis. And a very interesting point of data that he found was that the 3 CEOs that stood out for their calm, cool, and collected thinking, and the fact that they had also taken the earliest action in the COVID-19 crisis, was that they all had a mindful practice. So top CEOs know the value of a strong, clear mind, which is what mindfulness practice gives you. If we look at successful companies like Google, Nike, LinkedIn, their organizations teach and promote mindfulness at work. They know that their mind is where the power comes from if we want to get through any overwhelm positively and successfully. So let's look right now. This was taken in 2012, so 8 years ago, showed that 87% of workers worldwide are disengaged. So burnt out employees outnumber the engaged 2 to 1. So to me, this is a crisis point, and this was 8 years ago. So those stats are already higher than that. So let's look at it, mindfulness like surfing, okay? So the waves are the overwhelm. So if we get stuck in the waves, it's heavy, it's pushing us down. If we're surfing, we're on top of it, okay? So this is what practicing mindfulness does. It takes us out of the overwhelm. So our mind is clear, slow, and we're able to focus. Once we can step away from that overwhelm, we're more rational. We now have a 1-second gap that between our thoughts and our actions and between our impulses and our reactions. It gives us greater control over our decisions and our responses. So the mind is just like a muscle. The more you exercise it, the stronger it gets and the more it can expand. And so how can we then practice this? So let's look. We're going to learn to train our brain. So how to practice mindfulness? Well, one great way is 5 senses. And you can do this sitting at your desk. You can do this walking outside, while you're driving, or while you're washing the dishes. And all you do is go to your 5 senses. So what am I seeing right now? And I can say it out loud or in my head. So right now I'm seeing my computer, grass, my window, a glass of water. Then I can go to hearing. What am I hearing right now? Do I have any tastes in my mouth? What am I smelling? And what am I feeling? Am I hot, cold? Am I happy? Am I excited? So this is a great way to just bring focus quickly, and this is practicing mindfulness. So this is the way that it can look, right? Learn to be present, enjoy the present moment. So we want to focus on having thoughts like the dog. I see the trees, I see the sun. So our 5 senses. Now another way that we can practice mindfulness is using the acronym STOP. So stop when you are noticing that you are feeling anxious and that you need a moment. Take a breath, pause, feel your feet on the ground. Observe and acknowledge what is happening inside of you. And then proceed with more awareness. Sometimes we just need that 2-second pause to be able to get grounded and feel like we can move forward. So I'm going to read you a little excerpt from the book called The Happiness Hypothesis by Jonathan Haidt. Suppose you read about a pill that you could take once a day to reduce anxiety and increase your contentment. Would you take it? Suppose further that the pill has a great variety of side effects, all of them good. Increased self-esteem, empathy, and trust. It even improves memory. Suppose finally that the pill is all natural and costs nothing. Would you take it? So I'm going to ask you to answer that on this poll that's going to come up. Okay. Would you take a pill that increased your self-esteem, empathy, trust, improved your memory, and was all natural and costs nothing? Okay, so we will see what happens here. That pill is available, and it's available to us at all times. And that pill is called meditation. Or we can call it breathing exercises. Oh, look at that. Thank you. 100% of you. There we go. So, I use breathing exercises because when people hear the word meditation, they freak out. And honestly, I was one of those people at the beginning. When I first started learning about it, I was thinking of people maybe in India who would sit for hours doing their oming and ahming. And I cannot do that. There's no way I cannot think for an hour. Okay, but this is not what meditation, that is meditation, but we can start at a different level. And all it is focusing our awareness on our breathing. And we can start for 1 minute. We can start for 30 seconds. And so I just really encourage people not to get afraid of the words that we use until we totally understand them. So Jerry Seinfeld says that it's like having a charger for your whole body and mind. That's what mindfulness is. So meditation is an exercise for your mind. Okay? It's a gradual taming of your brain. And it's like learning to run. It's hard at first, it can be a little bit challenging, but the rewards increase over time. And one thing to note is that we will all get monkey brain, where our thoughts come in and out and crazy, and that is normal. And we're just going to become aware of them, and then we're going to focus our attention on something to bring us back to the moment. So that might be our breathing. We might focus our attention on that. We might focus our attention on our body. Do a quick body scan. Start at your toes, feet, move up all the way up your body, your shoulders. I would take it a little bit slower, but all the way up your body. That will focus you to the moment. Okay? You can even just count your breathing. You breathe in and out, 1. Breathe in and out, 2. Okay, that helps us just to bring our focus back to our awareness. And it is a practice though. So we have to practice it to get better at it, like any other skill. So you're not going to run a marathon after practicing and running one day, right? You will not reap the benefits of meditation until we consistently do it every day, but it can be in small amounts. Let's say 1 minute a day. So here are the things that we've been talking about. And so the next one is a minute to arrive. Okay. So when you sit down at your desk to start work, when you are about to come back after lunch, right before you do a presentation, or at the beginning of a staff meeting, you can do a minute to arrive. So maybe it's 5 deep breaths everyone's going to take. Maybe it's breathing in and lifting your shoulders up, and as you breathe out, you release your shoulders. You do that 10 times. Okay? It can be 30 seconds of writing down all of your thoughts, just to kind of clear your brain out. It can be a 3-2-1 exercise, which is taking 3 deep breaths, saying 2 things you are grateful for, and saying one act of kindness that you have done or that you have seen recently. And then you can also just do the 5 senses as a minute to arrive too. Another example is taking away distractions will help us to practice mindfulness, right? Turn off the pop-up notifications on your phone. Answer your email during a dedicated time. And finish one task off before you go on to the next task. Because we are training our brains to multitask, and it is harmful for our brain, and we are not efficient when we do that. Take a purposeful pause. So sometimes we can have things that remind us to do this. So maybe a specific rock or something on your desk, maybe a sticky note that's up somewhere that you look at often. Maybe every time you stand at the elevator. These will remind you to do something. Maybe it's just taking 3 deep breaths. Maybe whenever I see that rock on my desk, I'm going to feel my feet on the ground. Okay. Maybe it's not walking and looking at the phone at the same time. So just taking these moments for a purposeful pause. And then we can practice mindfulness in our meetings. Not allowing phones and computers. Having one person just take the notes and then forward it on to everyone. And giving everyone the opportunity to speak uninterrupted. So where you are, just be there totally. So I think that looking at some of these stats at work is just really important. So this was one study. 64% of employees describe their jobs as stressful. 52% believe their mental health interfered with their work. 24% have had a panic attack at work. 41% have been diagnosed with a mental health issue. But only a quarter felt comfortable asking to take a mental health day. So I just believe that this practice is more and more important, that we deal with it every single day with mindfulness so that we can take these stats down. So this practice, to practice any art, no matter how well or badly, is a way to make your soul grow. So we just need to do it. And I just want to quickly go over the benefits of mindfulness, because I think we just forget, right? We have less sick days, increase of resilience and empowered decision making, better creative ideas, improves communication, which leads to positive team relationships, increases focus and performance. We are happier overall. We reduce reactivity, increase effectiveness, improves coping with stressful events, increases our working memory, empathy, and compassion for others, and increases our productivity, increases our daily energy levels, our engagement, reduces symptoms of depression and anxiety, and decreases employee turnover. So I just really encourage you to know that mindfulness can make a change within your health, within your happiness, and within your wealth, within your company and your business. So I encourage you to stay here. The brain says he's looking at the past, but the heart is like, no, let's just stick to the future, or stick to the moment. Sorry, I looked at the future sign. So we just want to stay in the moment. So right now, I would like us to look at one more poll as to what activities, support, or education is your workplace implementing to keep your mind strong? And go ahead and click as many of those as you think. All right, so I'll be interested to see what's happening there so that we can kind of share what we all are sharing and what we're all doing at work. All right, Hilda. So, any comments?
Just letting these people do their poll. I see about 4 respondents so far, so we're waiting for just a few more before we end the poll. Yeah, because this will be important for us to kind of get a sense of what people are doing. It's probably taking longer because there's so many different options. And again, it's multiple choice. So
yeah, that's right. It's
yeah, we're at 40% now, so we'll just give it another 30 seconds maybe. They're coming in faster now. People are getting through that long list. So we'll give it 20 more seconds. We've got 8 people so far responding. And again, I would encourage people to comment in the chat box. We are going to open it up for some discussion purposes. Perhaps it's a good time for you to close your slides so we can open up our slides, yes, Kim. Yeah, and absolutely. I think there's 9 out of 15, so let's just close the poll now, Jenny, and share the results. So do you want to comment on them, Kim?
Yeah, I love sharing gratitude because that's a really easy one. Team mental breaks, good. Education, community volunteering is a great one, so that's a great one to see. Excellent. That's awesome that we're seeing at least some of these things being implemented.
It's nice to see the education in mental health is at 44%. And I love the community volunteering because it's also a team building strategy, right? Team building strategy.
Absolutely it is. Yes.
Cool. So we're at about, we've got about 15 minutes to go. So we want to share some of the questions that Kim and I came up with. And the first one we wanted to talk about, which leads from the poll, is the tips and strategies for economically promoting and practicing mental health. We're cognizant that everybody doesn't have a robust budget. So Kim, do you want to start off by saying some of those practical economical tips that you might have for the workplace?
Yeah, for sure. So, I mentioned quite a few in my presentation, but another one is definitely standing for meetings. Standing keeps us more awake and more able to focus, or going for a walking meeting is another really great way too to be able to stay focused. Kindness, and kindness can be small, right? Looking at someone in the eyes, saying hi. When we are kind to other people, our hormone oxytocin is released, which is the same hormone when we hug someone. And so just being aware of when we can be kind to others is actually increasing our mental health. And, just starting even meetings, if you're excited about mindfulness, maybe you'll have a group from 11 during your coffee break for 10 minutes. right? And whoever wants to join can join. If they're not interested, that's fine. But it's a really simple way to gather people and to just practice focus together.
Those are great strategies. My brother is a dean at one of the universities, and he decided to practice the 1 hour walk. He will start his walk. If anybody in the grad students want to join him and talk to him, those are that's an office hour. Just walk with the dean, and you can say, hey, I got this. So there are simple things, and the recognition. Really recognizing people, making them feel valued, gives them more peace of mind so they can focus on the day. Yeah. So would appreciate people putting things in the comments as Jenny's just popped up. And that way you share it with others. And Jenny will kind of wrap it up and share those with us as we're kind of talking. The second question we wanted to talk about was really, how do you sell a mental health promotion program if there's really resistance in the workplace, i.e., the senior team says, no, we don't need that, we don't have this problem, we don't have a budget for it. So what are some of the strategies that we can offer to others who are saying, yeah, I think this is great, but how do I sell it? How do I sell it to the organization?
Yeah, well, I think first of all, education is a must. That we just have to really talk about how mental health and the benefits of these activities, how they affect us, and that it's not just it's our health, how it can increase your bottom line, right, and your productivity. But the more that we talk about it, the more people start to say, oh, okay. So sometimes it's just taking some time to educate. I also feel like using the proper words. So I probably wouldn't walk in if I wanted to start something in my own business and say mindfulness or meditation. I might say an attention exercise or a focus exercise. Because like I said, some of these words scare people because they don't understand what they mean.
Well, mindfulness has been a buzzword for probably at least 3 years. And people would say, yeah, I do mindfulness. And nobody really understood it. And I remember attending a session where the person actually had more time than I'd given you, Kim. And so she focused on making us close our eyes and, grounding our feet and being present in the moment. And then asked people what they felt at the end of that 5-minute exercise. And there was this reduction in stressful energy, right? And a feeling of calm take over. And it really literally only took 5 minutes, and it's cheap, right? It doesn't cost you anything to do that. So I think you're right. It's educating people. I think the other thing from a business person's pragmatic perspective is to have numbers. Like, in mental health, 20% of people will have a mental health situation challenge in their lifetime. But that means 1 in 5. And when you sit down and think of it, I've got 20 family members extended. That means 4 people have had a mental health episode. And when I stop to think about it, I say, oh yeah. And that happens at work. If you've got 100 people in your company, 20 of them have had this. So if you think you don't have a problem, you do have a problem because you're not aware of it. The second thing is during COVID, they expect that depression will be that number 2 reason. So that 20% could be 30, 40%. Mm-hmm. So really, that's a number that's got to help. And people, I think, realize when they have a little bit of stress, they can focus. But when it becomes so big, they can't figure it out. So using numbers, factual about incidents and factual about the bottom line and how it's going to help, will probably help move those people who need those numbers in their head to make that decision. The next point we want to come across. Jenny, I'm going to stop there. Has anybody made any comments and wants to share? I think I saw one pop up on the screen about team meetings. Do you want to share that with us as a group?
Sure. Teresa asked, how do you encourage individual team members, like not the leadership team, to participate when they are very resistant?
Yeah, so what I recommend, and depending, I guess, what you want them to be involved in, but start small And you have to be the role model, right? We have to role model what we want to see. So, you know, we can just open it up, even a meeting, a staff meeting, say, I'd like everyone to share one thing that they are grateful for. Now, or you can open up to who would like to. Okay, you do it. If no one else does it, that's fine. The next day, you're going to do it again. And I will guarantee you that someone else will jump on the bandwagon with you. And it might take a while, right? Not forcing, right? But we're going to gently nudge. And so we have to be the ones that are the role model for that.
And I think you can always introduce it at a staff meeting and say, this is part of the staff meeting, and you do it open. Or if you have weekly meetings, weekly team meetings, you open it up with, okay, you know, I know everybody's had a busy day, you know, we got to get to the meeting, but let's just pause. Let's center and get into the mindfulness, because then they'll focus on the meeting. They won't be distracted about what they just finished off at that last meeting that they were at. I think we have another question which really nicely lines up with number 3, but share that with us, Jenny.
Yeah, for sure. So Megan has a question too. What are some of the best strategies and tips for managers who have had an employee come to them with a mental health issue that they are having?
Great question. Thank you for asking that. So item number 3 is called the role of EAP, Employee Assistance Programs, which program means it's redundant, and manager support in fostering mental health. And Kim and I had an interesting discussion on that. And I'll let you share the gist of that one.
Okay. So I was talking to a leader in a really big oil field company here. And, you know, he had said that when my people come in to talk to me about, you know, we talk about mental health as a group, but, you know, when they come in and talk to me, it's not my job to listen to them. And I give them the card with the benefits on it, people to call. And I was like, I think it is your job. It's your job to listen, not to help them. Okay. You don't have to guide them and give them instructions as to what to do, but they just need to feel heard and valued, so that when they walk out of that room, they are like, okay, well, he listened to me, he cared, or she cared, right? And they might be able to go back to work, but they walk out of there with you like, here, go call this person, and not willing to just listen. They're going to be ticked off, and they're not going to work for you as well, right? So listening for me is number 1. And be honest, I don't know how to help you, and I don't understand what you're going through, but I'm going to support you. And you're going to keep checking in with that person. How are you doing? Were you able to find someone to talk to?
Yeah.
Right?
Yeah. And to, exactly. It all, whenever you're faced with a conversation that kind of just, you know, you didn't plan on it and you're not sure what to do, first of all is say, let's talk. Tell me what you're thinking. Share with me. So it's listening. And when you think you've heard it all, listen some more. And then when you think, okay, I have the answer, listen some more. Ask questions that just encourage listening, so that they feel heard, they feel valued, and they feel respected, because that's important. And as Kim says, you don't have to know all the answers, but you can say, geez, I can only imagine what you're going through, and it must be really tough. What do you think we could do to help? And you might be able to accommodate that. And you might say, geez, you know, we can help you with this, this, and this, but I'm not sure about this and this. You know, let me think about it a bit more, and let me figure out. I might have to talk to a couple of people. You know, again, if it's in confidence, but I might have to talk to a couple of people if we can do certain strategies I'm thinking about. Let me get back to you, and then honor that. Get back to them. So it's all about, you don't have to be the expert. You don't have to know the answers, because you don't know the answers, but go see how you can help and find out the answers. So hopefully that helps you. And this one was really targeted to say, EAP is not the panacea. EAP is one support system. You as the manager are key support. Develop the relationship with your employee. And that's another answer for Teresa's question, is you can start by having a person who's resistive, maybe resistive for a reason. And it might be, you have that conversation. Hey, I know you didn't seem to be so crazy about this idea. just wondering what's your perspective is on this, so that I can help understand. And you might find the objectives, I don't want people to know that I have this. And then they may share that they have a problem. So they wanted to show their bravery. So it's all about building a relationship of trust and of openness, so that you do know when people are having mental health issues.
Yeah.
Number 4, let's go on to 4.
Can I just add one quick
Sure.
stat there, Hilda, is that, 60% of people will not seek help for a mental health problem that they're having. And 40% of people will go to those benefits, but 60% won't. And
Yeah.
so that's why it's just so important that we need to have the culture, right, of working on mindfulness and working on our mental health all the time, just when we get to that brink.
So we've kind of covered a little bit about this, but I certainly want to make sure, what do we do internally to support people?
Yeah, so is that, sorry, just explain that one
In
again.
a company, what can we do? It's sort of the same idea. We've talked about the employee doing that.
Yeah. And I think that, the biggest thing is being a role model. Okay. If this is something that's important to you, you need to always be adding support, even though people aren't asking for it. Because you can say, oh, how is everyone here at the table? Everyone's fine, right? We need constant support, because people are not fine. If we can look at all those stats we've shared today, people are not fine. So, do you also look after yourself? Okay, so you're that role model.
Yep.
You need to have regular talks about well-being and what that looks like. And then have frequent conversations, frequent communications, whether that's conversations or writing.
Yeah, and it is about building a relationship, because when you have that relationship, they will come to you with minor stresses, major stresses, and if they know that you're there, you listen and you support and try to help. That's the key. But
Yes.
if they think their job is in jeopardy, or you won't understand, or you'll even add more stress because you're constantly looking at them to see if they're managing, then they'll just clamor up. And somebody says here, stigma. It is. Mental health is still that stigma. I was at a breakfast meeting where somebody was talking about an event for fundraising for mental health, and I came to her and told her how fascinating and her work was, and what a noble cause. And she says, you're the only person that's come to me. It's like I have this disease. People don't want to talk to me because it's about mental health, and they're afraid if they come talk to me, they must have a mental health problem. So like, I'm like, really? And I thought, oh yeah, I guess I get that. I think you have to feel comfortable in your own skin to understand that people aren't looking at you with such a lens like that, but it does happen.
And just remember, it's wellness as a whole. And I think that's why education is so important. The more we talk about it, we don't have to necessarily always talk about mental health problems. Let's just talk about how to stay positively mentally healthy all the time.
Yeah. I know early in COVID, I tried to stay here in the zone. It's a little bit of stress, but not overwhelmed. And I stopped anything that was negative in terms of all that commentary about the woe and doom and gloom. And then I got so busy, I forgot about that. And I found that stress level go a little bit up a notch, and then not being as productive. And then I have to step back and say, yeah, remember that positive kind of stay in the zone that you had before. So I had to refocus on that. The next question, and the last one, I think, is just really opening it up for discussion. Do people have any other comments? Do they want to unmic or make comments? We're going to continue to progress through our last few slides. Somebody says, I think we need new language, something like mind wellness rather than mental. Yeah, totally think that, yes, we have to think about how we phrase things in a more positive way, right? Because it's not mental illness now. I was very careful to use mental health, mental wellness. We've been doing 23, we've got 21 episodes, and I think we were doing 2 a week, and now we're doing 1 a week. And so we have a whole list of webinars, if this is your first time or a few times, I'm sharing with you the topics that we have done. And these are available on YouTube, and you're welcome to subscribe, or you'll get a copy of these slides and you can click onto the slides. The next slide.
Sorry, just to chime in here, someone asked whether they would get notes of all the mindfulness options. So again, the webinar will be recorded and posted on our YouTube channel. And maybe if we can have Kim to also write down some of the mindfulness options that are not on a slide, that would be great too. That's just a recommendation. That's up to Kim.
Okay. Your thoughts on that, Kim?
Yeah, actually, once we get, I can type in a few things here, but once we get to this part where I can definitely,
okay,
it'll chime right in.
So I wanted to go ahead and share these slides with people, talk about them.
Okay, so if you would like a free download of 7 strategies to help you power through overwhelm, which is a lot of the strategies from today, you can just go, there's the website to go to, and we also show you where you can email me also. If you download it by Friday, I will send you a promo code to receive $25 off my new online self-paced program that's called the Mindful Answer for Work, and that will be launched the beginning of July. So once you get that download, I will get your email, and then I can send you that promo code. So if we just go to my contact
information, I was going to say that there.
There is my email, kim@innerpoweredleaders.com. So please feel free to email me, and I can definitely send you a copy of those 7 things also, the 7 strategies that we talked about. And I would love to stay connected. You can follow me on Facebook or LinkedIn right now. Those are the best places.
I've really appreciated having you here, Kim. You are a wealth of knowledge and you are an experiencer. And I think people who have been in your shoes really appreciate hearing you and knowing that your journey has this positive outcome at the other end. And I think that's always really important. So thank you very much. I want to go to the next few slides, Jenny, so that we can wrap it up, mindful of everybody's time. We've gone over a little bit today, but I think sometimes the questions and the comments are really rich, and I hate to push that along. At People Bright, we really can help too. We've been offering these sessions for people because we care. We want you to feel empowered to make good decisions. And as a business entrepreneur and as a specialist in human resources, really, this is a time when there's so many questions and so many ways to do things. I do offer this 30-minute free strategy session to help you through some of the difficult decisions that you're going through. So this is my offering, and if you want, I actually have a copy of an HR assessment tool that if you're not sure what you're doing in your company and you want to do kind of, how am I doing? We're going to send that to you if you wish to receive it. Next slide. So our next session, I am so excited about because we've been talking about various aspects. I'm bringing on people who have experienced going through COVID, and I want to share with them with you. So next Wednesday's session, that's back at 10 o'clock, really talks about what is happening with individuals, their journey right when we got into COVID, what they're doing now for their business, and what they plan for the future. I have Anu Badani, who is the CEO of an after-school program that focuses on STEM. And then Maria Collins, who is the Vice President of HR for Dana Hospitality. 2,000 people, or maybe more, and they had to lay off 1,000 people at one point and start work share. So that experience, I'm looking forward to sharing. Diane O'Ball is a senior HR professional, and their company has turned out to be those people that you now have that super clean happening. And last but not least is Alex Presley of Williams HR Law. And she is going to come and help us with HR questions as we've carried through that journey. So I feel it's a really robust discussion that we're going to have, and I look forward to people joining that webinar series. So if you know of other people who are interested, send a copy of the invite to them. We will break for July 1st, and then we'll be back on July 8th. Next slide. So a special thanks again to the East Gwillimbury Chamber of Commerce, who have helped us to spread the word of the webinars that we do. Any other questions that people have? Jane, do you see anything else? Anybody want to come forward?
Lauren, do you want to share something?
Oh, I just wanted to say thank you. Thank you very much, Hilda, for including the East Gwillimbury Chamber of Commerce on these sessions. It's been great to promote these out to the businesses here, but also just across the region. I think this topic was a very, very important one on taking care of mental health. And Kim, you provided some wonderful tips and ideas for us to take forward for ourselves and for dealing with our employees. So thank you very much for your time today.
Any other thoughts? If not, I thank you very much for your time. I do hope you will join us for the next one, because I think it'll be so rich with people's experiences that will help you think about, yeah, maybe I should be doing that, or changing the way you've done things, or patting yourself on the back for a job well done, because it has been a very, very unique time we find ourselves in, and it has challenged us to rise to the occasion. And I think we're, as humanity, are doing an okay job of it, if not even a good job of it. So again, thank you, Kim, thank you, Lauren, and thank you, Jenny, for helping us put this on, and thank you to all the participants. Stay safe. Bye.
Bye. Thanks, everyone.